Hello, and thank you for joining me on the Dr. Suzette Glasner podcast. Please don't forget to subscribe to my channel if you want to continue to learn from me. Like my videos if you're learning something valuable. And importantly, I would love it if you would share your comments, questions you have for me, and or any suggestions you have about guests who you'd like to see come on the show. You can also email me directly at askdrglassner@gmail.com. Last week, I sat down with J.D. Vance's mom, Bev Akins, and we talked extensively about her recovery from a 15-year battle with heroin addiction. If you haven't checked that episode out, you definitely should. So today I have sort of a related topic to talk to you about, and it's really about how our current generation is accessing opioids. There are so many different ways that can happen, but there is a new trend that is very disturbing whereby young people are gaining access to opioids in gas stations and convenience stores by accessing products that are sitting on the shelves. I'm going to be talking about products that are related to a substance called kratom. It's also sometimes referred to as kratom. Today, I'll talk about it as kratom, but just know that those can be used interchangeably. And in particular, there's a synthetic derivative from kratom that is being consumed increasingly by young people. That's referred to as 7-OH. But before we can talk about 7-OH and what it is, which is a very potent synthetic opioid, let's talk a little bit about what kratom is, because to understand 7-OH, you kind of have to understand what it's made from. Kratom is actually an herbal extract. It's from the leaves of an evergreen tree in the coffee family. It's referred to as Mitragina speciosa. It's found in Thailand and other tropical countries in Asia. In Southeast Asia, traditionally, the leaves have either been chewed or placed in tea, and the effects that it has are either to relieve fatigue. So in the short term, it has these sort of stimulating properties to relieve fatigue and improve work productivity. So think about somebody working a shift where maybe it's all night and they need a little boost in the same way that we would drink coffee. They use kratom. And it's also been used as a substitute for opium in the treatment of medical conditions, including pain conditions and diarrhea. It has also been used traditionally in various religious ceremonies. So in recent years, it's really been the focus of increasing interest in Western countries because it's thought of as perhaps an alternative to medications for opioid withdrawal symptoms. So I have had various patients who have come to me saying, I'm taking kratom because I'm thinking that might actually help me get off of prescription opioid pills, or that might help me get off of heroin. But then ultimately what I've seen them go through is a really challenging time getting off of kratom. And we're learning more about why that may be. But I'll also say it's sold as a dietary supplement, so it's much easier to access than another opioid-containing medication. That said, it is being banned in various states because of some of the reasons that I'm going to talk to you about regarding 7-OH and kratom more generally having addiction potential that was perhaps not realized by a lot of people who were taking it. So it is illegal to buy, use, or sell in an increasing number of states, and it's also considered a controlled substance in a number of states as well. So state by state, this is going to vary in terms of how they regulate and what their laws are surrounding kratom, but I will say that many states are onto it as a potential danger that it could drive more addiction, more dependency, more withdrawal, and especially among our younger generation. So there's two compounds that are in the kratom leaves, metragenine and 7-hydroxymetragenine. So the 7-hydroxymetragenine is this 7-OH compound that we're seeing surface in products that are being sold in gas stations and in convenience stores. And these are compounds that interact with the natural receivers that we have. They're also called receptors in the brain for opioids. So we call them a partial agonist. That means that they share properties with medications that we use for opioid substitution. So for people with opioid addiction, this is actually a very similar kind of substance that partially activates the opioid receptors in the brain and stimulates them. So in low doses, kratom makes a person feel alert, as I mentioned. In high doses, like commonly used opioids, the effect of kratom on the opioid receptors makes people feel sedated, it makes them feel euphoric, and it also reduces pain. There are a number of studies that are starting to accumulate to demonstrate that people who are using kratom for these purposes are really developing an addiction to kratom itself. And then what happens is that they end up having to take some of the same types of treatments that we use with individuals who come to us with a heroin addiction or with another form of opioid addiction to prescription pills, because they are experiencing the same symptoms. And those symptoms include withdrawal, anxiety, muscle aches, like the whole dope sick phenomenon that ultimately leads people to seek out opioids in ways that are very unhealthy, that interferes with their life. This can all be triggered similarly by increasing use of kratom. The other documented health complications that can arise from using kratom include overdose, bacterial infection from using contaminated products. Also, women who are pregnant and who are using kratom, their babies can be born in opioid withdrawal. So this is something that we see with moms who are addicted to heroin as well as other opioids. It's known as neonatal abstinence syndrome. It can also lead to thyroid problems and liver damage and seizures, as well as psychiatric problems like psychosis. So kratom is not without its risks. And again, to successfully discontinue using kratom, a lot of people do end up going through the same type of medication treatment that we prescribe for individuals with addiction to other types of opioids. And so there is research concerning the safety of taking kratom, and that really has produced mixed results. So animal studies, and that's how we always start when we're trying to understand the safety of a substance, they show that high doses of kratom may be less likely to be fatal than high doses of other opioids. Deaths related to kratom have indeed been reported. And in fact, they have increased pretty dramatically. Just as one example, between 2010 and 2015, there was a 10-fold increase in calls to poison centers related to kratom exposure. In the majority of those cases, kratom was mixed with another substance. That is how we see overdose occur very commonly in general, is when several substances that are potentially downers are mixed together, and that leads to a depression of the respiratory center. When your respiratory center is depressed, you stop breathing and you can die. So when you see kratom on a shelf, the assumption that it's safe because it's herbal is not correct. So now I'm going to shift gears and I want to talk a little bit about 7-OH. So as I mentioned, this is a compound in kratom, hydroxymetragenine, and it's thought to have its own misuse and addiction potential. And what's important to know about 7-OH is that it is found in small trace amounts in kratom. It is not the same thing as kratom. It's a synthetic concentrated derivative. It is an opioid, and it is 13 times more potent than morphine. What's even more concerning is that it is being falsely advertised as kratom. So given that it's a highly addictive, potent concentrated derivative, this is really different from kratom. The way that it's disguised makes it very attractive to young people. So these 7-OH products are disguised as attractive candies, gummies, and even ice cream cones that parents might never see as a risk. Look at the ice cream cones. This would be so easy for a kid to pull from the shelf, especially if they're hearing that it makes you feel good from somewhere. So they're marketed as 7-hydroxymetragenine, 7-OH-metragenine, 7-OHMG hydroxy, 7-HMG, or just 7. And all these compounds pose significant health risks. So let's talk about what are the health risks associated with this 7-OH. First of all, because it's up to 13 times more potent than morphine, it greatly increases the risk of overdose and dependency. So your body's not used to this highly potent opioid. That's actually part of what happens when people overdose, is they end up consuming a far more potent opioid than their body is capable of handling, because the body hasn't developed tolerance and it's not used to it. And that can lead to that sort of respiratory center shutdown and overdose scenario. So according to a study run by the National Institute on Drug Abuse, 7-OH resulted in that respiratory depression that I'm describing at a magnitude that was 3 times more severe than morphine. That's not surprising. If the drug is more potent than morphine, then the impact on certain systems in the body, like the respiratory system, is going to be stronger. So we are starting to hear more and more stories around severe addiction in young people and of major withdrawal symptoms. This is comparable to somebody coming off of painkillers or even heroin, or somebody who unknowingly took fentanyl and started to become dependent on it. The side effects or the withdrawal effects include insomnia, anxiety, body aches, and sweats. And we are seeing that poison control reports that involve kratom-related products are increasing year over year, and that includes 7-OH products. We don't have great reporting on the prevalence of 7-OH use because a lot of people are using it unknowingly, so we're just starting to learn more about it. But certainly the FDA and the DEA are onto this, and they are doing quite a bit of investigation right now to figure out how to classify these substances and how to potentially regulate them. But important to know that right now, because they're unregulated, most 7-OH products don't even state what the concentration of 7-OH is that's in them, nor would that even be that meaningful because we still have yet to study what the meaning of different varying concentrations of 7-OH in terms of clinical signs, symptoms, and dangers would be. Some of these products are marketed as kratom extracts or enhanced kratom, and they're sold on the same shelves as kratom. And we also know that the majority of these are manufactured in unsupervised manufacturing facilities in India. And so people who are using them are probably receiving very inconsistent doses of them because, again, they are unregulated. So I think the important thing for you all to remember is that 7-OH is an opioid. Kratom-related products, including 7-OH, are not safe approved treatments for a lot of the things that people want to use them for. They want to use them for anxiety. They want to use them for pain. They want to use them for opioid withdrawal. And anecdotally, they're hearing that this could be a helpful alternative. And again, because it comes either in an herbal format or in a seemingly harmless packaged format as gummies or as ice cream cones or something else that looks very visually appealing and looks very harmless. Don't be deceived by that, and don't allow your youngsters to be deceived by that. These are opioid products, and early exposure to opioids, as well as other substances that tap into our dopamine system, are known to interfere with brain development, increase the likelihood of future addiction developing in our young people. So at all costs, we have to do our very best to prevent them from being exposed at an early age to these types of substances. And this all applies to adults as well. This is not just a warning for young people. Kratom and kratom-related products, and in particular, these potent products containing 7-OH, are extremely dangerous for adults to ingest as well. So stay vigilant, know what you're consuming, look on the labels of products, and educate your children to look at the labels of products to see if it says anything about 7-OH or hydroxy, mitragynine, or kratom extract, or enhanced kratom, anything kratom related, anything 7-OH related. Proceed with extreme caution. And if you wish to experiment with any kratom related products, talk to a healthcare professional, talk to an addiction specialist, and learn more about them, because you really might save yourself a real roller coaster of a formation of a dependency on a substance that you were just taking to feel a little bit good, a little bit better, or to experiment or have a little fun. Thank you for watching today. I hope you learned something valuable, and I will see you next time.